How to write a mental treatment plan. A psychological evaluation is a fact-gathering session in which a mental health worker, counselor, therapist, social worker, psychologist or psychiatrist, interviews a client about current psychological problems, past mental health issues, family history and current and past social problems with work, school and relationships. A psychosocial evaluation can also examine past and current substance abuse problems as well as any psychiatric drugs the client has used or is currently on. Most mental health facilities provide the mental health worker with an evaluation template or form to complete during the interview. The counselor will conduct a mini mental status exam, MMSE, which involves observing the client's physical appearance and his or her interactions with the staff and other clients at the facility. A diagnosis is chosen based on the client's symptoms and how they fit with the criterion outlined in the DSM. The DSM is the diagnostic classification system created by the American Psychiatric Association, APA. Use the most recent version of the Diagnostic and Statistical Manual, DSM-5, to locate the correct diagnosis. Once you have completed the initial assessment and made a diagnosis, you will want to think about what interventions and goals you might want to create for treatment. Typically, clients will need some help identifying goals, so it helps if you are prepared before having the discussion with your client. The interventions are the meat of change in therapy. Your therapeutic interventions are what will ultimately evoke change in your client. Identify types of treatment, or interventions, you might use, such as activity scheduling, cognitive behavioral therapy and cognitive restructuring, behavioral experiments, assigning homework, and teaching coping skills such as relaxation techniques, mindfulness and grounding. After the initial assessment is conducted, the therapist and client will collaborate to create appropriate goals for treatment. This discussion needs to occur before the treatment plan is made. A treatment plan should include direct input from the client. The counselor and client decide, together, what goals should be included in the treatment plan and the strategies that will be used to reach them. Try using a SMART goals approach: specific, be as clear as possible, such as reducing severity of depression, or reducing nights with insomnia. Measurable, how will you know when you have achieved your goal? Make sure it's quantifiable, such as reducing depression from 9/10 severity to 6/10. Another option would be to reduce insomnia from 3 nights per week to 1 night per week. Achievable, make sure the goals are attainable and not too high. For example, reducing insomnia from 7 nights per week to 0 nights per week might be a difficult goal to achieve in a short period of time. Consider changing it to 4 nights per week. Then, once you achieve 4, you can create a new goal of 0. Realistic and resourced, is this achievable with the resources you have? Are there any other resources you need before you can, or to help you, achieve your goal? How can you access these resources? Time limited, set a time limit for each goal, such as 3 months or 6 months. A fully formed goal might look like: client will reduce insomnia from 3 nights per week to 1 night per week in the next 3 months. Your goals need to be as clear and concise as possible. Remember the SMART goals plan and make each goal specific, measurable, achievable, realistic, and time limited. Make sure this is done as soon as you have completed the treatment plan. You want the dates on the form to be accurate, and you want to show that your client agrees with the treatment plan.
If you liked the video, subscribe to our channel for more awesome videos. Check the description below, and thank you so much for watching.